Welcome to the third part of the Lions Clubs International Pediatric Vision Screening Program. With me is past International Director, Dr. Ed Cordes.
Well, hello again, everyone, and thank you very much for tuning in to Part 3 of the Lions KidSight USA PowerPoint presentation. We gave you an overview of the program in Part 1, and we talked a little bit more about some of the specifics in Part 2. Sometimes people say, you know what, we heard you, but I don't even know where to get started. What do I do to implement vision screening in my community? Well, really, it's quite easy. We have developed 3 different models from which Lions can choose, and if you've never done screening before, and just getting started, we suggest that you think about getting started at the beginner model. In the beginner model, we're going to ask you to consider what tools you want to use to do vision screening. And as you know from the previous presentations, we have 2 outstanding corporate partners, Plus Optics USA and Welsh Allen Spot, who both make outstanding machines that will enable you to do very, very effective screening in your communities. So I would suggest you reach out to them on their websites and reach out to the different salespeople in your areas to find out what they have to offer. Work with the machines, talk to some of the clubs around you and find out what they're using. Pick out a machine that fits your needs the best. You might consider a sharing basis. In my own home district, for instance, we have about 37 Lions clubs, and there's about 7 machines spread out among those 37 Lions clubs, and we have a calendar system where Lions clubs can reserve machines to borrow for their use. And that helps spread the cost out so that every club doesn't have to buy their own individual machine. But once you decide on doing the screening and buying a machine, you want to put together a system that can actually get you into the areas where the children are, that you can do the screening effectively. So the first thing you want to do is be sure that you have a HIPAA-compliant system. HIPAA is the privacy law in the United States. You can please check out our website, which is www.kidsightUSA.org. On that website, you'll find samples of HIPAA-compliant forms that other areas have been using, and you can reach out to parents to get permission to do the screenings when you do them, and it also gives you some ideas of reaching out to various agencies in your communities that you can do the screenings. We suggest reaching out to Head Start programs, to nursery schools, to daycare centers, various religious schools, certain children's camps and programs where young people are congregated with an agency environment where there's an executive director or an administrative assistant that can help you organize your screenings amongst those children. Health fairs are useful to get involved initially. It certainly gives you exposure and gives you the opportunity to show what vision screening is all about, and then use your success to go into the various school systems to show how good vision screenings are. We already talked a little bit about the HIPAA-compliant permission forms, but be sure that the form that you use has what we call an opt-out checkbox. What that means is that the parents automatically give you permission to call them to find out if those children who were referred actually followed through and brought their child to the eye doctor. If they check a box, they know they are opting out and not giving you permission to call them. But if they don't check the box, then they are automatically giving permission for you to call them to find out the results and of whether they followed through with the referral. Both machines have documentation that they produce with the screening results. In other words, whether the child passed the screening or failed the screening. It gives an estimate as to why the child might have needed a referral, and those screening results can be given to the parents and also given to the eye doctor when they go. It should be pointed out, however, that this is just a screening, so any of the results on that screening form, screening document, are not to be considered a diagnosis, but an indication that further investigation by a comprehensive eye exam is needed before a diagnosis could be provided by an eye doctor. You also want to have a network set up to provide follow-up exams. So go out into the communities, talk to your local eye care providers, tell them that they're going to be seeing patients that are referred by the Lions Club screening process. Introduce them to the machine, introduce them to the forms that they will see. If necessary, find a network of docs that can take care of the medically indigent people who either don't have insurance or for whatever reason, if they have insurance, the deductibles are so high that they still can't afford to bring their child to the eye doctor. Talk to the Lions Clubs in your area, or use your own Lions Club to help supplement the funding in those instances. Finally, we would ask that the beginner model maintain a list of screening information. In other words, a database. What we're looking for is the number of children that you've screened, what the age of the children, each child that you screened, how many children were referred, and then within 4 to 8 weeks later, find out of the number of children who were referred, how many went to the eye doctor. This is a relatively simple model to get started. It allows you to go out into organized areas, schools, nursery schools, daycare centers, and so on, to reach a reasonably large population of children. You could also designate the agency administrator to do some of the follow-up for you. In many cases, they prefer to do the follow-up. Or you may have a lion in your club designated to assist the agency in doing the follow-up. Again, I recommend between 4 and 8 weeks later. Relatively simple, relatively easy, does require some organization, does require some effort, but actually when you do it, it's not as hard as it seems. And what I would recommend is, if you've never done screening before, reach out to your surrounding clubs or surrounding districts even, and find someone else who's doing screening in their area and visit them. Attend the screening that they're doing. See how easy it is using their model, and then bring that model home to your own area and implement it yourself. Once you get going and have done screening for a period of time, you may consider expanding your efforts. The intermediate level of Lions KidSight USA Children's Vision Screening would accomplish all of the above that we talked about in the beginner model, but you would coordinate the program at a wider geographic area. So that area might be a zone or a district. It might be administered by a district-level appointee. You might have a district foundation that helps you obtain equipment and maintains a database for you. You might have a wider network of eye care professionals supporting the program. Some of those Lions coordinators could be volunteers, or because of the size of your area and the number of follow-up calls that need to be made, you may actually have a paid person help you with permission forms and referrals and follow-ups. Pursuing regional partnerships means that you may be able to find some other interested agencies, whether they be professional agencies or funding agencies, that could help you set this network up. They may be able to help you with equipment funding. They may be able to help you with funding for the district coordinator. Certainly reaching out into other like-minded organizations can expand the effort and influence of Lions Clubs, give you a better handle on showing the world what Lions Clubs are doing in children's vision screening. In the intermediate level, it certainly would require a larger database to collect the information we talked about before, number of children screened, number referred, what their ages were, and so on. Because it's a larger area, it's going to require a little bit more effort to collect and maintain that data, and that's why you may have to have a central database coordinated by either a volunteer or a paid person. Finally, there may be a very advanced vision screening program that's connected with a large university setting or a large foundation or clinic. Frankly, this is the way many of the early vision screening programs started back in the days when the MTI photo screener that used the Polaroid film were being used. The results of that needed to be professionally interpreted. So Lions Clubs and Lions districts had partnerships with the clinics and universities to do the reading of those Polaroid pictures. And then along with that reading, they also did a database and did funding and grant applications and so on. But certainly not every Lions screening program is going to need that level of service. And for those of you who are thinking, how can I get started? Where do I first put my foot in the water? I would suggest that you review on the website the various forms. There's a PDF on a step-by-step how to get started in the beginner model of vision screening. The important thing is that vision screening is providing you with a tool for you as a Lions Club to reach out to your communities, identify those children who are at risk for vision loss because their problems are not detected before age 6. It allows you to make a tremendous difference in their life. It also allows you to reach out to the community and do something visible and something significant that can, in turn, help you build your own club. So, Lions making a difference for the next generation. Lions KidSight USA. I hope you found this useful, and I look forward to hearing from your successes.